I'm Dr. Federo, a board-certified plastic surgeon, and I'd like to take you through an actual rhinoplasty consultation. So this is an actual patient. So this young lady, a 23-year-old, came to see me complaining about her nose. At the time of consultation, I ask all my patients one basic question. What don't you like about your nose, and what would you change if you could change it? I often ask them how their breathing is as well. So this young woman told me that she didn't like the bump on her nose, which you can see from her before picture, and she didn't like how round and big her tip was when you looked at her from the front. So from that point, she asked me how many of these I've done, and I have done several thousand rhinoplasties over 25 years. And the reason that's important is that we know that the best results come from rhinoplasty surgeons with the most experience. She then asked me if I could show her noses that I've done similar to hers. So I have a book of rhinoplasty results, and we took that out and we actually went through and looked at different cases that I've done over the last 2.5 decades that illustrate that type of rhinoplasty. At that point, we went into the back and I examined her nose. I watched her breathe, I looked inside her nose, I felt her skin to see if it was thick or thin, and I took some basic pictures. And so you can see from this first picture, you can see her profile. And then from the second picture, you can see the head-on view, and you can see the bump that she doesn't like and the fullness of the tip. At that point, we took the morphing software and we started to make changes on the computer. And so I showed her what her nose could look like. And she told me, that's too much, that's too little. And we came to an agreement on what the nose should look like after the surgery. So this young lady decided to have a rhinoplasty, and you can see her post-op results. This is from the side. We took down the bump and gave her a nice smooth profile. We've refined the tip so it's not so bulbous and it blends better with the rest of her nose. And you can see that I think we did a little bit better than even the morphed images. And she's very happy with this result.